There are a few times when gaining weight is actually a good idea. One of those times is usually during pregnancy. But as LURENE CACHOLA reports, there are still limits when it comes to eating for two.
It's a routine checkup for Program Manager Leslie James. She's just weeks away from delivering her second child. She had been working on losing weight and getting into better shape in the months before learning she was pregnant.
I just really had felt like I had got to a point where I wasn't comfortable with my weight, and for my own health reasons just felt that it was in my best interest to start a plan with my doctor to lose weight and to kind of monitor that. So I was 2 pounds from my goal weight when we found out we were expecting, so that's the way things work sometimes.
Once she became pregnant, she knew she would regain some of the weight she lost. Her OBGYN, Tom Greenwell, says that's to be expected because a baby's growth and development depend on weight gained during pregnancy.
I try to make an analogy for my patients. I said, if you've got a project, say you're going to build a new house, it's important to use the best materials that you have and use the correct materials, and that way you're more likely to get a good project. And the same thing with building a baby. You know, it's the most important, the most precious thing in your entire life that you're ever going to have. And so you want to use the best materials possible to build it.
Doctors use a woman's weight before she gets pregnant, along with her body mass index, to figure out how much extra weight is appropriate.
And so the total weight gain in a normal, healthy, normal weight individual is somewhere between 25 and 35 pounds.
Here's where the extra weight goes. About 8 pounds for the baby, 2 to 4 pounds in breast tissue, another 2 to 4 pounds for the uterus, 1.5 pounds to 3 pounds in amniotic fluid, 3 to 4 pounds in maternal blood, another 3 or 4 pounds in extra fluid, and from 6 to 8 pounds in fat and nutrient stores. Adding the additional weight should occur slowly.
They say in the first third they would like to see them maintain their weight, maybe gain anywhere from 1 to 5 pounds, and then from 15 weeks on gain 1 pound a week.
It's really been gradual. There was a couple of times where it was a bigger jump. I think the biggest jump was like 5 pounds at one time, and I was kind of like, okay, maybe I need to watch a little bit more what I'm eating.
It's just as important to stay within the suggested guidelines and not treat being pregnant as an excuse to gain too much weight. Dr. Greenwell says most women will only need an extra 150 to 300 calories a day. He says for most people, that's a glass of skim milk and half a sandwich.
The best way I explain to them is we know you're eating for two, but that doesn't mean you eat twice as much.
Putting on too much weight during pregnancy or being overweight when becoming pregnant can greatly increase the risk of complications for both the mother and her child.
Obviously, they're at increased risk for hypertension, gestational diabetes. They're also at a higher incidence of having a macrosomic or a very large baby. They're at higher risk of having a C-section.
According to Dr. Greenwell, women who gain the recommended amount of extra weight should lose most of it within a few days of delivery. For James, she's ready to work off whatever weight remains after her son is born.
I don't think putting expectations on that, just kind of take it a day at a time. Hoping to get out there, got a great jogging stroller, so hope to get the baby out there and get walking as soon as possible, and just to get back into a healthy lifestyle, which I was trying to do before we got pregnant.
For Smart Medicine, I'm LURENE CACHOLA.